We did the Salmon Polynucleotides facial on him. So that's a salmon sperm treatment that you may have seen, the latest trend from originating from Korea. And this is actually used to build collagen and elastin on the skin. Really great treatment for the under eye area, and it helps to plump and hydrate the skin from inside out. We did do on Ian, so I'm excited to see the results. It was a couple days ago. Yeah.
I'm like, how am I looking? You were super on camera.
Now you look 12.
Hi, and welcome to Beauty Curious. My name is Dr. Elise Love, and I am a board-certified dermatologist.
And I'm Ian Michael Crum, a licensed esthetician.
Ian and I are excited to become your trusted beauty guides, from interviews with the best and brightest names in the industry to sharing our favorite expert-approved products.
We are here to help you navigate the noise by giving you the facts. Are you feeling beauty curious? Let's dive into today's episode. Everyone, we are back. Welcome to Beauty Curious. We're super excited. Today, we have Dr. Tsai. She's actually my optometrist, and we are talking all things eye care, everything from dry eye to eye cancer prevention. So, Dr. Tsai, she is the founder and owner of Line of Sight in Hudson Yards, New York. She speaks on a lot of panels. I really just feel like she's the face of optometry at this point. So, I'm going to pass the mic to her. Hi, Dr. Tsai.
Hi, thank you for the wonderful intro. You come in, and a lot of patients who are looking for a more preventative and regenerative route to both vision and eye care health. That is something that when I started Line of Sight was the sole focus on being able to provide that different experience, different therapies. And the fields that I specialize in include dry eyes, ocular aesthetics, and myopia management, which includes non-surgical ways to correct vision and prevent progression. So, yeah.
Amazing. So I'm super excited to talk to you because this is an area that obviously affects everyone. And I will admit I don't know a lot about. So let's just get right into it. What exactly is dry eye, and is it becoming more common in like the modern world?
Dry eye it's such a multifactorial disease. And
Yeah.
so it's funny because half the population will experience symptoms and half will have symptoms, will see it clinically speaking, but they'll be completely asymptomatic, as in they have no clue that they have dry eyes. It is objective, but also subjective. But really, it's just when our eyes don't produce as much tears as it should, either due to a variety of factors, environmental, genetics, hormonal changes, age, a few other things that we'll get into, but that leads to symptomatic issues like redness, tearing, burning, just irritation and discomfort, and even blurry vision. And it is becoming more problematic today because we are actually, if you guys can guess, it's been, spending more time on screens, on technology, whereas before we would actually spend more time outdoors. And the problem with technology and reading and screen time is that we're actually not blinking as much as we used to, which actually drives dry eyes.
They're like,
Yeah.
I'm here like, okay, guys, blink, blink,
I'm
blink,
blinking
blink.
right now.
I'm thinking about blinking. But are there
Yeah.
any other daily habits? Obviously, we're in front of our screens right now, so now I'm going to be conscious about my blinks. But are there any
Yeah.
other daily habits or environmental factors that also are contributing to dry eye?
There are definitely, I mean, if we just start with, let's say, things that we do at home, like we said, blinking is a huge one. So our blink rate drops by at least 50% from what we know when we stare at screens. And that's because
Wow.
we're trying to use our eyes to focus. So if you're doing that for a prolonged period of time, and it's not just your laptop, it's also your phone. If you're like scrolling through social media, it's the same thing. If you're reading a book, it's important to implement like daily habits to take breaks. You may have heard of like the 20-20-20 rule. Have you guys heard of that?
I believe I've heard you
It
say
sounds,
it.
I think
but
I've heard it once.
Yeah.
Yeah.
I'm like, I don't
Yeah.
remember.
It's like
20,
20
20,
minutes on 20 seconds or yeah.
Yeah, exactly. So
Okay.
every 20 minutes, take a 20-second break to look at something 20 feet away.
20 feet away. Yeah.
I don't think it's possible for anyone to remember that, right? If you're actually like working and you're looking at your screen. I would just say like every hour, get up, go to the restroom, take a break, look at something further away, like instead of looking at your phone is the whole purpose. You don't want to take a break and then the break is looking at your phone. The break is really to promote relaxing your eyes so that you're actually not fully focusing on your object.
Okay, and then what about beauty products? So makeup, skincare, we know that like artificial lashes are really big right now.
Right.
How are those affecting eye health?
Yeah, so beauty products, I mean, you know so much about it as well, but there are ones that the skin around the eyes and the area around there is quite sensitive. So the skin is much thinner. It is much more sensitive. People oftentimes can develop like eyelid dermatitis, eczema around the lids, even rosacea, ocular rosacea can occur as well. And even products. So products that tend to be too harsh on the skin, if it's waterproof, if you're using specific glues for lashes or lash extensions and you don't clean the lids well, that does lead to usually it can clog your oil glands, which actually most people don't realize line externally where your, they call it your water line is. And so if you're putting your tight lining, using eyeliner, waterproof mascara, and on top of that, you're not removing it properly. Even for men going to the gym, working out, and then not cleaning that area afterwards, they're really just, the meibomian glands are like little pores. So if they produce oil, but they get clogged just like your skin, then that can lead to other issues like styes and infections on the lid margin. So certainly like beauty products to avoid are the same things that you probably would generally avoid for your skin, looking for products that are formulated without like harsh chemicals, fragrance free, but also sometimes when it comes to eye related products, I would say products that, again, do try to avoid waterproof if possible, things with too much glitter or shimmer in the product, because that can irritate the eyes as well. There's even like best ways to like remove makeup at the end of the day to make sure that you're actually taking off your eye makeup properly without tugging or irritating your skin too.
So you mentioned dry eye and clogging the glands, which, as I
Right.
said earlier, Dr. Tsai is actually my optometrist. We wanted to ask what are the most effective treatments for dry eye, and I want to make sure we talk about the treatment you did on me.
Yeah.
It was confusing because my eyes kept watering, and I'm like, Dr. Tsai, why do my eyes keep watering so much? And you were like, they're dry, and I'm like, what? So can you explain that into explain
Yeah.
the treatment we did to my eyes to help with the dry eye?
Yeah. So many people sit in the chair and they're like, I don't think I have dry eyes. My eyes water so much. That means I don't have dry eyes. Or like, I can cry when I watch a movie. That means I don't have dry eyes. I thought like dryness is like, I can't produce any tears at all. But it's like the opposite. So what happens is our tears are made up of three components. We call it the aqueous, mucin, and lipid. But the predominant ones that get affected are the aqueous production, which is the watery component that comes from our lacrimal gland that sits up top. And then our meibomian glands make the oil of mucin, which is to help the tears stick on the surface. So when you blink, the function of blinking, other than to protect your eyes, is to keep it lubricated. So what it's doing is it's mixing the aqueous, the water, with the oil. And so when you blink, it now creates this nice lubricant or this coating. Now, if your oil glands are clogged or you're not making as much, what ends up happening is your tears, when exposed to the wind or the cold in the wintertime, especially if you're walking outside, if you notice that your eyes water a lot or they tear up a lot, that is a sign of dryness because your tears are actually not properly lubricating and staying on the surface. So then your eyes become irritated and it's producing this reflex tear, but it's not sticking.
Because
And so that's usually
the
dryness.
oil gland is clogged, so there's nothing mixing to have it stick.
Right, right. So majority of people who deal with dryness, there's a few different causes. You can have a combination. It's either you're not producing enough, so you're deficient, or you have evaporative dry eyes. So evaporative dry eyes is without the oil production or a reduction in it, your tears evaporate quicker. So 86% of dryness, from what we know from clinical data, is from meibomian gland dysfunction or evaporative dry eye disease, which just to tell patients, you know, hey, go over the counter, go pick up some eye drops, some artificial tears. Why don't you put a warm towel on the lids? Though those treatments are great maintenance at home, because of such a change and shift in our lifestyle and even the environment, pollution, the weather, things like that, makeup we talked about, what ends up happening is that the treatments that we've had available has not caught up with our modern day living, the way that we live our lives. And so there is a need for more. And really, we don't want to rely on medication these days that are chronic medications that are hard to remember to do, but also treating a problem really after the problem started instead of really targeting, hey, what's the root cause? So the treatments that I focus on at Line of Sight is really to bring into the forefront technology that is more advanced on the cutting edge to help regenerate and restore your own natural tear loss and return the function back to the glands. And one treatment, I think we did two, but one on you that we did was radiofrequency. Radiofrequency is a device that's actually used for beauty as well. People use it to stimulate neocollagenesis for collagen. So it's a great treatment for the face, but even under eyes for, under eye bags and hollowness. But what's amazing is that this device helps to actually break down the meibomian glands that are clogged. We're able to unclog it because the energy is delivered subdermally to where the glands are sitting by the lid. And it helps to release the oil, release and kill the bacteria, and reduce inflammation. And we can see that with the treatments after 4 sessions, there's a bit of regeneration to those glands that we see. Because oftentimes, if there's too much damage for too long of a period of time, those glands start to shorten and we start to lose them permanently. Contact lenses also cause dry eyes too.
Mm-hmm. Didn't you say too, whenever we were doing the treatment, that it's kind of similar to like if someone were to have a pimple, like when we looked at the image of my glands in my eye and how they were clogged, it's like the idea of if you have a congested pore, it's like these glands were also clogged, and mine thankfully weren't awful, but like I remember seeing photos of people's who were really bad, and it's like you actually press with Q-tips to like squeeze it out.
Right. Yeah. So we express it. So the glands, imagine like they line up, and the goal is to have nice, clear olive oil consistency. So if we press on your glands, what should come out is this nice, transparent olive oil consistency. But when they're clogged, it can turn into like, if you can imagine like thickened butter, like yellowy cheese. And this type of production, we can tell that, they're already clogged. When it gets really bad, it gets to the point where it then comes out like solid strings when we press on it. And then end stages, when we press, nothing comes out at all. So that's if there's complete loss to the gland. But we do a lot of diagnostic imaging in our office. So these devices take an infrared image of the glands. We can show the patients, hey, each column where the shortening is, they can visibly see it and compare before and afters. We can also measure the dryness on the surface, which will look like almost your cornea, which is what you look through, right? That's where you can experience dryness. If there's dryness, it's hard to explain what that looks like, but if you can imagine like a window and it's very scratched on the surface, it's hard for you to see through that, so it does impact your vision. Or if you think about your skin in the wintertime, how it's really rough and patchy and you can feel it, that's what it looks like on the cornea when it's dry. Wow. Without the lubrication. But things like even like blepharitis, we mentioned ocular rosacea, that's like eyelid inflammation, flaking of the lids, that also contributes heavily to like all of this. So LASIK surgery does as well. Certain medications, and I think people are shocked that one of the first questions I ask if someone comes in for a dry evaluation, have you ever been on Accutane? The patients, you might remember when you had it done like 10 years ago, 20 years ago, but you forget. And then what happens is like 10 years down the road, 20 years down the road, now it's starting to cause irritation because the everyday things that you're doing, wearing contact lenses, looking at screens, it probably exacerbates it. Things like ADHD medications, anxiety medications, allergy medications, antihistamines also cause dry eyes as well. Medical conditions too, thyroid disease, a host of other things. Yeah.
That's why we all have dry eye.
Yeah. We live long enough. We all do.
Beyond dry eye, what would you say the most common eye health concerns you see in patients are today?
More in like their concerns or more?
Yeah, I would say like what are people coming in for other than dry eye? So you mentioned ocular rosacea.
Mm-hmm.
What else are people coming in for?
If we group them together, we can consider it like all related in the same bucket. We talked about dry eyes, rosacea, blepharitis, styes. Styes are very common.
Oh yeah.
But I would say people are really concerned. What we're seeing is a shift and increased concerns of myopia progression. And though, it is not we call it a condition or a medical condition, but, everyone has a prescription, or not everyone, but most people might have some sort of correction. But what we're seeing is that there is an increase. In the next 20 years, half of the world globally will be nearsighted. So this is becoming a bigger issue. And what happens from there are risk factors when there is increase in myopia progression. It can lead to glaucoma, and it can lead to things like retinal detachments, retinal thinning, and that can lead to sometimes vision loss. So that is something that I think across the board we're seeing that shift, or I'm seeing that shift.
And that's probably related to the screens.
The other half of it is really genetics out of our control, right?
Okay.
So if one or both of our parents wear glasses, that's one risk factor. That increases your chances. If you started wearing glasses before the age of 10, the risk factor increases for your progression throughout your lifetime, even after age 21. The third risk factor would include more hours spent on your work, which can include, again, your phones, laptops, books. But we're just spending on average way more time than we did in the past on near objects.
Outside of this talk of the 20-20-20 rule, making sure we're giving our eyes a break from screens, we're all glued to the screens. What are some other everyday practices that our listeners can adopt to make sure that their vision is protected as we all age?
So for vision, the worry is progression. It is important to spend a good balance or amount of time outdoors. We are seeing that sunlight exposure is actually, some amount of it is actually healthy to keep our, it's called the axial length of our eye stable, which is to help prevent progression. Also taking breaks from screens to look at further objects. And there are ways that are alternative corrections that actually, like I specialize in, which is might be a prevention to help prevent progression. One is called Ortho-K. It is a non-surgical way to correct your vision that's not LASIK and involves sleeping in this kind of like a retainer, like similar to Invisalign for your teeth, but for your eyes. You wear this to sleep. In the morning, you take it off. It actually fully corrects your vision so that it eliminates glasses and contact lens during the daytime. But it also is FDA approved to slow myopia progression. And that's the most important thing. It helps to stop your vision from worsening each year. We also have a version called MySight. It's a type of corrective lens that does that as well. And even digital anti-fatigue glasses, they're blended lenses that we design that are specially made to help our eyes accommodate better to screens. And that has helped, we found, keep prescriptions relatively stable. In terms of eye health, it's very important to have a healthy diet, fruits and vegetables with a lot of antioxidants in it for the cornea and for the eyelids and for dry eyes, making sure that you have omega-3s, salmon in your diet, but also wearing sun UV protection, especially in New York City. People think that they don't need to wear sunglasses because there's tall buildings. That is not the case. We're constantly exposed to sunlight. We're sitting by the window. There's indirect light bounces off of buildings. So, sun damage is slow and cumulative. So it may not happen the next day, but it happens over time. And it can lead to things like cataracts, early signs of macular degeneration, pinguecula or surfer's eye on the front surface of the eyes, and even melanoma and things like that. So it's very important to wear sunglasses. And to avoid smoking is another one. Avoid smoking because that can also lead to early changes to the eye health. Getting, diet, exercise, getting checked for that because diabetes can be actually caught in the eye. And someone with diabetes can have diabetic retinopathy, as well as hypertension, high blood pressure can lead to hypertensive retinopathy. So cholesterol even can occur in the eye. So these are all the things that we check for. So it's very important to have, relatively healthy diet with antioxidants, protect your eyes from sun, and exercise and avoid smoking.
You mentioned the glasses that you guys carry in the office. Are those blue light blocking glasses? Are those different? Do blue light glasses work? Or is it, I feel like everyone's like, is this a sham or is this real? Like, what's the deal with those?
Yeah, I would describe blue light glasses in this way. So when we step outside, we wear sunglasses. And what sunglasses do, they protect your eyes from the whole visible spectrum of sunlight, right? The sun emits a spectrum. But when you're indoors on screens, there is one specific wavelength that's emitted, and that's the blue wavelength, which is much shorter. So when that's emitted, it does, we do know that it can cause changes to our circadian rhythm at night, change our sleep patterns, cause insomnia. We do see that it causes sensitivity to light. So the best way to explain what blue light does, or filtering, is it's a coating on the glasses, similar to a filtering that you would have in sunglasses, but it's filtering out just blue light alone that is emitted from screens. And that does help with light sensitivity. So if you work in an office setting where there's fluorescent lighting, just uncomfortable, bright, harsh light, it's really helpful for that because our eyes can be very sensitive to light and it can experience a lot of glare. So I would say blue light helps with that. We're still not sure. I mean, of course, there's ongoing data to see if there is long-term retinal and macular damage from blue light. So that's something we'll see. But I always say there is no harm in wearing the blue light coating because it's really just a coating that is added onto any lens. That is different from what I was describing for the myopia prevention. That is the way the lens is actually designed. So the prescription that's built into the lens, a normal standard pair of glasses, we correct your vision for 20 feet. That's why it's called 20/20 vision. And so that means no matter where you're looking through the lens, the power is the same. But in a specially designed lens, it's actually graduated. So it's blended. So the correction that's meant for distance, you'll need more because it's further. But for someone who's nearsighted, when things are closer, we don't need the full correction to see your monitor. So a little bit less helps our eyes relax its accommodative state to focus better on screens, and that helps alleviate eye strain and fatigue. And so the lens power is actually graduated through the lens.
Wow, very fascinating. I'm learning so
Yeah.
much.
Now it's interesting stuff. It's like a whole another world.
Yeah.
We talked about earlier this idea of like, taking your makeup off, eyelashes. There's also colored contacts. I feel like merging with beauty trends, it's a lot to balance. Like, oh, what am I doing that's the best thing for my health versus participating in, a beauty aesthetic or trend that you want to do. So how do you advise your patients if they want to wear eyelashes or wear colored contacts? Like, how can they do that and also be safe?
Right. It's never a no. I mean, you can have one provider that says absolutely not, don't do this. But, everyone wants to be able to live a life that they want to live, a lifestyle that they want to live. It's all about things in moderation and making sure that you're choosing the right options, the healthiest option or the safest options. So things like colored contacts, let's say, even I wear colored contacts when I want to go out or take photos, but it's how often are you wearing your colored contacts? Is it all the time? And are you choosing brands that are safe to wear and are you replacing them on time? So if someone, let's say, opts for colored contacts, make sure that they're FDA approved, make sure that their, daily options that are colored are going to be better than monthly options of colored lenses. Making sure that you're wearing them for a short amount of time and not wearing them every single day, all the time on screens. It's all about moderation. With lash extensions, it's never a no, but if you are choosing it for a specific occasion, you want to get your lashes done, making sure you go to an expert that that you trust that does a good job on the lash, using chemicals that are not too harsh, but also you're giving your lashes a break in between, so you're not doing it all the time. And if you're going to get lash extensions, make sure that you're really cleaning it properly at the end of every night to clean the lash, the baseline, to remove all the buildup and to take care of them. And so I think it's really about, the frequency and making sure you're choosing the safest option.
Yeah, that's so interesting because I feel like with lash extensions, people are always like trying to avoid water around them, which is like the opposite, obviously, of what you should be doing for your eye health. It's one of those there's so many like beauty trends where it's like, no, but you're like ruining your skin health or your hair health or your lash health. So that's fascinating. We talked a little, you mentioned earlier about ocular melanoma. We have like, obviously Ian is like the spokesperson for like sunscreen and like prevention of skin cancer. But talk to us about how ocular melanoma gets diagnosed.
It can be very scary. That it is rare, but it does happen. In my lifetime so far, I've seen it twice, once in school and once practicing. Ocular melanoma develops really when the cells that produce the melanin in the eye, it's known as melanocytes, just like your skin, but ocular melanoma is considered a malignant tumor, and that can spread to the parts of the body if it's not caught in time. Is this something that someone will know? In the beginning, you likely will not have symptoms. You may not know until it gets to a point where it's very concerning. So usually where it can form is in parts of like the conjunctiva, which is the front portion of the eye, or tissues around the eye, surrounding the eye, but even in the iris, the ciliary body, the choroid, and more commonly the retina. The retina is actually inside the back of your eye. It's not something you can see by just looking at yourself in the mirror, but that's actually where all your nerve endings are. That's actually where your vision is. That's where your optic nerve is. Those are where your blood vessels and arteries are. And that's where it can develop. The most important thing is really to go in and get checked, to get a routine eye exam once a year to make sure that place properly checks for retinal disease and retinal conditions by checking the posterior retina. And what we look for is any signs of abnormal pigmentation in areas that are more concerning, any elevation, any sense of bleeding, any areas where it looks suspicious. You can have benign freckles in the back of the eye, but sometimes that, we are concerned if there is a chance that that could be melanoma. So I remember having a patient that came in, I think this is like during the pandemic, that we just could not get that eye to see better than like 20/80 for some reason that most people don't realize. They're sitting there working, you're not sitting around with one eye closed until, he realized when we were in for the exam. So we did a dilated exam, we did imaging, we saw an area that was very concerning on the retina, and we sent him immediately to a retinal specialist to have that examined. So yeah, and ended up being, ocular melanoma. So that was quite scary to see that happen. And it was, someone with a light colored eyes can be more at risk, but this person was a darker skin patient and young too, I think in his 30s. Yeah.
Wow.
Yeah, so probably not
Yeah.
on his radar at all to
No.
be even like a
No
bit
family history even.
concerned. Yeah. And so I totally agree that like once a year exam, make sure you have your whole eye looked at because yeah, we just can't be aware of what's going on, especially in the back of the eye.
Exactly. Yeah. I mean, if there's family history, I definitely would get checked.
Yeah.
Consider getting it checked regardless. Yeah.
So when I've come in, we do it's the imaging of the back of the eye. What's the official term for that? The photo we take with like the orange
Retinal imaging.
retinal imaging.
Retinal imaging.
Is that common across like all optometrists? Because I mean, I've been seeing you now for a few years, but I was trying to think back to like past eye doctors I've seen, and I don't always remember that happening. Do like all eye exams normally include that or no?
I would hope that most all should. Every place should have. I can't speak for every office, but and also you may have remember being dilated, right?
Oh
So
yeah.
dilation is a way for the doctor to take a look at the back and use, our own eyes to visually check for these conditions. And we also now have machines that can also do a scan and check for it. And if there is something that we see, we also then dilate to get a closer peek at it. With imaging, we're able to now capture how it looks like so we can compare year to year. And that's how we want to track something. So more advanced technology only helps us as clinicians diagnose and monitor issues for our patients. So I hope so. Yeah.
You just have all the advanced machinery at line of sight. So I was like, wow, what's all this?
Yeah.
I love all
Most
the eye
offices should.
machinery. It's so
Yeah.
fancy.
Yeah.
How common are other forms of eye cancer beyond melanoma? I know you said you've seen melanoma twice in your practice. Have you seen other forms at other times?
Other forms, I mean, there's basal cell. We can see that on the eyelid or the conjunctiva. That is, I have seen one once before, and not that it's not scary. I think it's easier to catch because it's on the front of the eye, right? So if you see it and there's family history of skin cancer, likely something that's changing on the front of the eye, you'll go in and get that. You'll have that checked, and that's going to be intervened in time. So, but basal cell on the lower lid is a very common type of cancer that can occur. There are some rare ones if we talk about like for kids, children at birth, retinoblastoma. Retinoblastoma is a type of eye cancer that typically will occur in one eye in babies or infants, and the parent may not really know. One of the things to look for is if your baby in dark light has a white reflex in one eye, like coming out like if you're taking a picture with a flash, but if you're looking and one eye has that reflection but not the other eye, definitely have that checked. Retinoblastoma is a type of rare eye cancer that affects basically newborns, genetically speaking. So those are probably the more common ones, I would say, when it comes to like eye-related cancer.
So basically, make sure you book your eye exams and always get your eyes checked because there's a lot of things to consider.
Yes, there's a lot of things to consider, and sometimes we catch things in the eyes first, right? It's a naked view of your arteries and your blood vessels. Our optic nerve connects to our brain. So pituitary tumors, the condition is sometimes if it's benign, but if things like cancers, like brain tumors, right? Where the optic nerve sits, the pathway beyond the eyes, where it transmits information to the brain, if a tumor is pressing on it, it can cause vision loss. It can cause issues that we'll see. So oftentimes, that's the first sign is like visual changes. And we see that the optic nerve is swollen or there's an occlusion. Then that could be, and if it's bilateral, if it's concerning, we might send them directly to someone, a neurologist, neuro-ophthalmologist, or even like a dilated pupil in one eye, a sudden dilation of a pupil in one eye. We're worried about cranial nerve issues. The eye in proximity is very close to the brain, and we are able to catch a lot of things first and send them immediately to the proper specialist for care. Yeah.
And then when we think about just taking care of our eyes and the normal wear and tear and degeneration that occurs, I know that you're really into regeneration and like high tech. So tell me about what are some of the latest advancements and regenerative eye treatments for eye restoration or vision restoration?
Yeah, I'm very, very excited about everything that's been regenerative eye treatments. One that I think is really neat that we do is for the corneal health or the eye health itself, sometimes vision, is using stem cell therapy. So we're able to take amniotic membrane from donated healthy tissue during pregnancy. That's donated to tissue banks. In hospital settings, it's been used for years for burn victims, wound victims. So it has a lot of regenerative ability to heal surfaces, regenerate cells, reduce inflammation. And now we have the ability to do that for the eye, which is pretty neat in office and not in a surgical setting. So if someone, let's say, deals with really bad dry eyes, or they've had LASIK done, and they have scar or any type of scarring from a previous eye infection, let's say sleeping near your contact lenses, you get an ulcer or you get an abrasion to the eye and it leaves a scar, we're able to use this amniotic membrane to heal the surface and regenerate it. And there's nothing quite like that. So it's now, I think we are the first to get in New York, we call it CAM 360. It is the first model of cryopreserved amniotic membrane tissue in the form of a contact lens. So we're able to actually place that membrane on top. You have lymphocyte cells on your cornea, it absorbs the membrane, and over the course of the time, it's healing and regenerating your own eye. And we're able to then take it off. It's not surgical.
Wow.
And again, these are ways to
That
improve
is
the
so
surface.
cool.
Pretty neat. It's pretty neat. And we'll see where that goes in the future. I think there's going to be a lot more implication or usage of that in other settings. Maybe it can work on my meibomian glands in the future, or who knows, like lash loss, or we'll see, or even inside the back of the eye. But around the eyelid skin for the under eye, such a common area that people often have like beauty and cosmetic concerns of under eye bags, dark circles, droopy lids, wrinkles, fine lines, and even extending to the rest of the face. So two of the regenerative treatments that we do, one is using exosomes. Exosomes is a great treatment for under eye area, and it uses in similar ways. It's not exactly live DNA, but it is mRNA messenger cells that are used, again, that's derived from the same area. But when it's delivered, it's through like a serum or a booster. We often apply it through microneedling, and that helps to really jumpstart the skin to repair aged cells, skin cells, to build collagen and elastin. And two, it's great treatment for anyone that deals with like rosacea on their skin, eczema, damage to their skin from sun damage, and all sorts of things. And the very newest thing that we brought and we're excited about that we did do on Ian, so I'm excited to see the results, is a couple days ago. Yeah.
I'm like, how am I looking? You were super on camera.
Now you look 12. We did the salmon polynucleotides facial on him. So that's a salmon sperm treatment that you may have seen, the latest trend from originating from Korea. And it's derived DNA from salmon semen. And this is actually used to build collagen and elastin on the skin. Really great treatment for the under eye area, and it helps to plump and hydrate the skin from inside out. So that's also something that is regenerative and moving people away from like let's say like under eye fillers, really, and towards how do we make your skin, I want to say age backwards, but how do we make it restore itself back to the state that it was in, when you're younger. So how can we help it regenerate on its own?
Yeah, I think that in the field of aesthetics in general, regeneration is just becoming a bigger and bigger field, but particularly when we talk about the under eye, I feel like under eye filler really it was a good option. It's a good option for a very small minority of people, but it's just become this
Okay.
point where whenever someone has problems in the under eye, they think that filler is the option. And so there's just tons of people who are either unhappy with their under eye filler or like bad under eye filler going around.
Yeah, yeah. And this is a great, again, alternative for that. And plus,
Yeah.
like, you have to get fillers done every so X amount of months, right? Because it dissolves. So to have an option that allows us
And what
to
was
regenerate is
it called
helpful.
again? Rejuvion?
Regeron is
Regeron. I knew it was
Regeron.
close.
Yeah.
Regeron.
You were right around it.
I
Yeah,
was,
you
I
Yeah,
were
yeah.
was,
Yeah,
absolutely
yeah.
right.
Rejuvenate. Yeah.
yeah,
Yeah.
totally. And so we did it with Morpheus 8. So do you always combine the Morpheus and then apply it topically and stamp and Morpheus again for a second pass?
Generally speaking, any type of would deliver through micro channels through the skin. So that's either done through Morpheus, which combines it with radio frequency energy, or you could do it with microneedling without the radio frequency. We have that version as well. And we have like a version where we can use like a mesogun, different ways to deliver it, but it's just micropunctures on the skin and you deliver the serum through that.
Amazing.
Yeah.
I've seen some posts on social recently, and I don't know the like technical term, but I've seen like posts about people doing eye injections to change the color of their eyes, which
Hello.
sounds really
The videos are
insane,
creepy.
like really weird, and it sounds dangerous. So I'm curious your take on. It seems like it's a social trend right now of like people doing injections to change their eye color versus like just wearing a colored contact lens.
Yeah. I mean, I think if it's not broken, don't try to fix something, like enhance it. I think when it comes to your eyes, especially, I mean, I'm not as well versed to these procedures. I know that there is one way to do it where in the past it would blast the pigment off, blasting the pigment. So everyone,
I know.
Elisa and
I
I
don't know
are
if you
both
know
like,
this.
what?
What?
My face
So,
even
so I
moved
don't
with
think you guys know this.
Botox. I'm like, whoa.
Yeah. People who have blue eyes, it's just that they have absence of pigment on their iris.
Yeah.
So if you have a little bit more pigment, you might have gray eyes. If you have a little bit more, you have green, and then you have a lot more, that's brown eyes. So when you blast away, like to some degree, amount of pigment, the light reflects off of the eye and it gives that color, blue or gray or green or what you're looking for. But the newer version that they're doing is actually depositing pigment, like you said, which, the first version, if you're blasting pigment, it goes somewhere and it doesn't leave the eye. So we become very concerned with glaucoma, which can cause your eye pressure to spike and lead to peripheral vision loss and damage to your nerve. This new version, it's supposedly less risky, but again, I feel like there's colored contacts for a reason. I feel like, it's a much safer option, I would
It's
say.
it seemed like baking to me when someone's like, let me add like 5 drops of red food coloring to see like this cake turn red. I'm like, I just can't imagine injecting pigment into the eye. It
Yeah,
just like
yeah, there's
really
always a
seems
risk for
wrong.
something. Yeah, yeah,
Okay,
yeah.
well, taking it all the way back to the basics, very far away from that. Let's just end by talking about what are the things that our listeners can just do on an everyday basis to take care of their eye health. So you mentioned diet earlier. So
Okay.
what can you just like reiterate what foods do you feel or has been shown to support eye health?
Yeah. Okay. So we talked about a few. I would say
Yeah.
when we think about like green leafy vegetables, so things like spinach, kale, collard greens, why are these beneficial? These actually contain a high amount of lutein and zeaxanthin. They're antioxidants that really protect our eyes from like UV damage and light. It also reduces the risk of like macular degeneration and cataracts. Things that are rich in beta carotene. So you think about carrots, there's some truth to that. Sweet potatoes, so these actually are great because it helps to convert into vitamin A, which is helpful for like nighttime vision. Also helps to some degree the cornea as well for dry eyes. Citrus fruits, which has a lot of vitamin C. Antioxidants are helpful. Omega-3s, so often you find that in fish like salmon, tuna, sardines. That's going to definitely help. Also, we talked about with like, again, like dry eyes, retinal health, a lot of nuts and seeds. They're a great source of vitamin E. So vitamin E helps protect our eyes from like free radicals as well. I would say those are the major ones. Berries, antioxidants, vitamin C as well, that are good to have in your diet.
What about supplements or any sort of ingestible vitamin? Do you recommend any of those for vision?
When you're looking for vitamins, really it's probably just comes down to the ingredients specifically. You want to make sure that the ingredient contains lutein, zeaxanthin, zinc, and then like vitamins A, C, and E are the ones that you would look for when you're looking for supplements or multivitamins for the eye health.
Amazing.
I feel like I learned a lot. I knew only a couple things because of being a patient of Dr. Tsai's, but I always love learning more things I can do and we all can do to keep our eyes healthy, our vision safe and beautiful. So yeah, thank you so much, Dr. Tsai, for coming on Beauty Curious.
Thank you. Thank you guys.
All right. Thank you guys for listening and have a beautiful day.